For this video, I'm going to be talking about anti-vaccination and how people are trying to convince others that vaccinating their children is not okay. So to start out, vaccines help reduce and even in some cases eliminate serious infectious diseases. And a vast body of scientific research shows that vaccines do not cause autism because autism is one of the things that people talk about the most in that vaccines cause autism, and they are essential in preventing the spread of potential fatal infectious diseases. When too many parents fail to vaccinate their children, it can jeopardize the entire community. So it's not just their children that they're putting at risk; it's the entire community, and even if we take it even further, it's the world. They're putting the world at risk. With people whose immune systems are compromised due to illness or chemotherapy are most at risk. So science has provided plenty of evidence that childhood vaccines are safe and effective, and public health authorities maintain that vaccines are as important as seatbelts in protecting our children. So if you would put a seatbelt on your child, you should vaccinate your child. And so, how can it be that parents opt out on having their children vaccinated, even in the face of diseases coming back into play? So, like the measles outbreak that has sickened more than 102 people in 14 different states is making a comeback, and these parents do not want to vaccinate their children. Basically, it's a trust in the government or a lack of trust in the government is one of the key factors in the reason why parents are not vaccinating their children. It's because they do not trust the government, and they believe that the government is against the people, and that vaccines are just for money and they're not actually to help. But many of the parents become anti-vaccination as a result of just plain old misinformation. So basically, they hear something that's not exactly true and they automatically think that it's not a good thing to get your child vaccinated. So, for argument number one, there is no proof that vaccines don't cause autism. The American Academy of Pediatrics has released a list of more than 40 studies that have been done showing that there is no link between vaccines and autism. But for some parents, 40 studies is not enough, and they would rather take the chance of their child getting a very deadly disease than autism. For me, I would rather have my child here and be able to take on the autism, because if your child has autism, it's better than your child not even being here because they died from some infectious disease. Argument number two is against argument number one, and that's one study in England did show a link between vaccines and autism. Yes, there was a study that was published in 1998 that did find a link, but the study was retracted, and the physician, the person who led the research, was shown to have put false information into the study, and the data was stripped, and he put false information in the data, and so he was stripped of his medical license. So people see that there was one study that showed a link in autism, and most of the information was not even correct, so obviously vaccines cause autism, which is not true. And then the third one, it's no one's business whether my child is vaccinated. Actually, parents who fail to vaccinate their kids may be jeopardizing the health of other children who are unable to get vaccinated because they are too young or for other different reasons. And they might think it's no one's business whether their child is vaccinated, but at the same time, they're putting the community and other children at risk who are not able to get vaccinated. And then argument number four, vaccines can overload a child's immune system. That is simply put not true. From the moment that we are born, we are exposed to all sorts of illnesses, illness-causing diseases. So most doctors and also the CDC agree that a child's immune system can handle the immune stimulating antigens in the multiple vaccinations that we get as children. And I think that if our bodies can take all of those um, things that we are exposed to when we are born, that our bodies can handle the vaccines. And it's not like you get all kinds of vaccines at the same time, you get them in different times. But this, all of this basically started even when back when vaccines were just becoming popular and people were not sure if it was a good thing to do or a bad thing, because they would rather wait the disease out and see if it would go away, basically, instead of getting the vaccine and getting better. And basically, there's been a lot of cases where diseases like I said earlier, the measles and even smallpox are making a comeback because people now are starting to not vaccinate their children. And the people that are not vaccinating their children were probably vaccinated as children. So it's kind of confusing as to why they wouldn't vaccinate their children and why they would rather put them at risk than get them vaccinated. I just don't really understand that. I know that they're afraid that it's going to cause their children to have autism or something along those lines, but I would rather have my child here and be able to live with the autism with the child than not have the child here. And there were a lot of these anti-vaccination movements happened soon after Edward Jenner came up with the smallpox vaccination. People weren't sure what was going on exactly. But a lot of the people that choose not to vaccinate their children, or the people that don't vaccinate their children are following, are people that have no medical or scientific backgrounds or who have been stripped of their credentials. So basically, it's just something that someone came up with and decided that we shouldn't be vaccinating our children because of this, this, and this. Although it is a parent's decision whether they want to vaccinate their children or not, I highly suggest that people do their research before they decide whether or not they're going to vaccinate their children, and actually make sure that the research is true and from a correct source, because you want to make sure that you're getting the right information and not misinformation like a lot of these parents are getting, and that leads to them not vaccinating their children, and it leads to a major outbreak in diseases that were once put on the back burner because we did have vaccines.